move on to table 2. You were looking at nurse training and development. What changes needed to be made there? We heard a few things earlier on this morning.
Indeed, and I hope to reflect the views of the table rather than imply these are views of the Department of Health. But nevertheless, I think our overriding assumption from this question was that in considering training and development, we're thinking about a huge workforce, not just about pre-registration nursing. Can't lay this at the feet of the university sector. Has to be very much a collaboration. But starting with the undergraduates, with the pre-registration students, we were slightly dispirited to think that we were discussing techniques which are used by many of us for a long time, but they're not done consistently, they're not done through proper selection and contracting and commissioning, as indeed they could be. The best organisations get it right. A lot of people are still not very involved, but it's very time consuming.
You're talking there about who sets requirements from the universities about what education
not just the requirements, but getting involved in the selection of students and then nurturing them through the whole system, so that from day one they expect to be registered nurses, they bring the right attitudes, values and attributes to the process, and we recruit for those values rather than just thinking about their academic ability and skills.
And that's the partnership between the employers and the universities?
Absolutely key, yeah. And then thinking about education itself, we moved on to think about how it's all structured. And there was discussion at the table about how hands-on is the curriculum at the moment. And there is a lack of understanding, and I think this is a public problem, that there is a 50-50 split between theory and practice, that there are 2,300 hours of theory in the programme, 2,300 hours in practice. But practice does mean that the NHS and others are really heavily involved in the quality of who qualifies, and that must be a crucial dynamic in making sure the experiences of those students are absolutely pertinent and they're not variable, that there should be some sort of standardisation, saying this is good enough or this is excellent, rather than just getting through. This failure to fail notion that we've had in nursing has got to be much more prominent as well, because if the NHS mentors don't establish that only good students are qualifying, then that's a big failure in the system. Following that, we thought preceptorship had probably gone off the agenda a bit, and it was a really important element of developing and nurturing a new generation of nurses, and it was heavily funded at one stage, but that may well have been eroded. And then we look forward, of course, to the new structure. What will health education in England look like? How this will be carried through in local education and training boards when they're set up. But it does come back to what is the image of nursing, what is our professionalism, what are our values, what are the standards, making sure students understand that from day one. And bringing that with that, not just our introspective view of what nursing is, but where's the external challenge to that? What is it like for patients from the public and their communities and their families? And bringing to that experience a whole raft of understanding around complaints, claims, clinical governance and so on can actually help the curriculum enormously, so that nurses, student nurses, understand what reality is and get that quality up.
I'm not a nurse, as you'll probably have gathered, so this question might sound really dumb, but when a student nurse goes on to the ward, how well prepared are the nurses that are there to support them and show them? Do they know what's expected of them in order to support those student nurses?
I would argue yes, they should be, but some of our discussion at the table was the reality is slightly different from that. And of course there is a variable factor around how experienced you are mentoring students and what you have to offer to that process. And it is a very demanding process and time-consuming process. And at the moment we're in a system that's fairly settled, but we are going through a change of curriculum, and we've got new Nursing Midwifery Council standards coming as well, and I think that's one of the big challenges to the NHS, is how the new students will be mentored. What do the staff on wards expect of them?
And a big opportunity to get it right, I guess, as well.
Fantastic, the opportunity of a generation.
Okay. Any other comments, changes that you'd like to see in the way that nurses are trained and developed, not just at the when they're new into the profession, but through their careers? Any point from that? You've gone terribly quiet.
Yes. Well, I'd like to see an element of common sense prevail, because we assume that most nurses go into it with the idea that they're going to help people, and somewhere along the line just common humanity seems to go very often, whether it's whether it's the degree course, whether it's just too much to do or whatever, but even quite often that general feeling that they started out with somehow seems to diminish over the period of that first element of their training, very often, if you don't have the right culture in the hospital.
Yes. Apart from culture, which is always this thing that's sort of blamed if things go wrong, are there practical things that could help reinforce that care and compassion outside of nursing?
Well, yes, I think that a very simple thing that could be done is that if every nurse, healthcare assistant or whatever was asked, or the culture was, or the training was, that they should just ask a patient at each point of contact if they have what they need and if they're comfortable.
Yes.
And that would stop all that walking away without even looking to see if the drink or the buzzer is there.
Yes, so the conversations in effect.
Yes.
One technique I've seen recently shown at the International Forum on Quality and Safety in Healthcare is video ethnography. Rick Iadema and Catherine Carroll in Australia, using video of real working practice, then edited down and played back to the team who are doing the practice. Tremendously effective in changing team behaviours, and I think that should probably be part of training for all the healthcare multi-professional teams. It saves the investment in simulation as well, because you're just recording real work and watching the real work, and I think that could be a great potential to improve the performance of almost any team.
Yeah, I mean, it sounds from what you're saying, it's an important refresher as well to keep that in people's minds.